Okay, hello and welcome back. How did it go with noticing the breathing changes? Did you manage to do it? I hope so. It's very, very useful. But today I want to share with you two more ways of calibrating the changes in either an emotional state or changes in behavior that a person has, and how to observe these little things that most people are just oblivious to. And this is more than just what happened with Andrew Agassi, noticing Boris Becker's tongue sticking in the middle or on one side. That's rather obvious. But if you manage to notice these very subtle differences, you're absolutely a master of communication, because you know then how to gear your communication exactly what it should be according to what the person in front of you you're talking to, you're communicating with, is going through, without guessing and without mind reading. Because I promise you, you'll say, oh, but I know pretty good what's going on with them. With all due respect, you don't. It's a guess. All you're making is a guess, and all you're making is what we call a mind read. You're just mind reading. And I'm showing you here how to be precise without any guess. So, next thing you want to pay attention to is the lower lip size. And I don't mean fillers, and I don't mean any of this. No, that's not what I'm talking about. I'm talking about the presence or absence of parallel lines like this in the lip. And that's very simple to know, because when a lip expands with blood flow, it's again a matter of blood flow. This is not magic. This is simply physiology. When there is no tension in the lip, there is the lip is relaxed, so there is more blood flow coming to the lip, and so there are fewer lines. If it becomes, it's almost like it becomes more swollen. So, ladies, if you want to have a plumper lower lip, just be in a relaxed state, joking. And if it shrinks inside, less blood flow, then the lip size tightens, and you look at those lines, and then you have more lines. It's kind of very simple, and yet how many people are actually observing this? So look at the thickness of especially the lower lip, from up to down, and you'll notice these lines or the absence of those. Now, that's easy to notice and not so important. If we were to rank in terms of importance, what will give you the most leverage, this is not at the top of that little list. Now, number 5, the next thing I want to talk to you is about the eyes. The eyes, you can look at the eyes in terms of the changes in focus and pupil dilation. These are things that are happening, especially pupil dilation happens automatically, and it cannot be faked. Okay, you cannot at will dilate your pupils or shrink them down. So the focus now, first let's talk about the focus. And the focus is actually when eyes are focusing straight there, like when you're looking at your phone, you're focused in the phone, or defocused when you're getting into peripheral vision, having a wider angle and being able to look as I look at the camera, but at the same time, I can see my hand here and I can see my hand on the other side without looking at my hands. I can see the movement of my hands, and not only because I can see it in the camera, right? But I get into peripheral vision, so the little itty-bitty muscles which are all around the eyes are relaxed. So this is how you notice focused and defocused. And again, it is a very slight difference, but if you really pay attention, you'll begin to notice what's the difference in these itty-bitty muscles that are around here that have the eyes move when the eyes are totally focused versus when they are relaxed and they are defocused. Now, defocused also means when I'm looking at the camera, but actually right in between here, I see another image. I can imagine my car. I can imagine a red rose, right? And this, by the way, you think that this is not important. This is how many people are trained not to move their eyes when they have a camera interview. This is a very important skill, defocusing. So you can notice this when people are, their eyes are defocused versus focused. Now, pupil dilation. If you are you are having a conversation online, then probably is a little easier to notice this, especially if the person looks straight at the camera. If you're having a live conversation, you may not be this close to the person to notice. However, if there is a big difference, you still can notice if the pupils are really, really widely dilated, because it's very little left of the iris, of the eye gallery, the part that's colored, right, of the eye, and then the pupil becomes so big. And also when it becomes very, very small, like a pinpoint, you can also notice this. Now, there are slight variation. It's not that obvious as I described right now, covering all the iris or being so tiny. However, you can notice differences in what does it mean again. Well, again, I'm sorry, but I'm going to give you the same answer. Nothing in isolation. But what if you're talking to somebody and you get it, and then they tell you about an event that happened to them, and all of a sudden you notice their eyes become more focused, and the size of their pupils becomes smaller. At the same time, you notice maybe more tension in their forehead or cheeks. That state, whatever that is, I'm not going to name it, that state, whatever that emotional state they were in when they were telling you the story, is associated with this set of features in the physiology. We'll get somewhere with this. We're getting somewhere with this. So what 99% of the people who attend, our practitioner training from the beginning, is they are able to notice very, very quickly the difference between a person that receives and they like what they hear from you versus something they dislike. It's so easy to notice. It's very, very easy to notice. And once you begin to notice these things, I'm going to share with you a little exercise that you all can do at home, but not yet. First of all, here is what I want you to do. I want you to practice for the next couple of days, 1 or 2 days, to pay attention to the lower lip size, only this, and or the eyes, focus, and pupil dilation. If you really have practiced what I suggested so far, by this time, you will be pretty good in spotting things that for most people are virtually invisible. So I hope you did, and I'll see you next time.